back to the channel. In today's video, I'll be taking you all along with me as I get ready and go through my 28-hour shift in the Heart and Vascular ICU. All right, so I just woke up and made myself some coffee. Trying out this light roast La Colombe coffee. It's a Colombian coffee brand. I also have this coffee creamer, pumpkin spice. It's that season. just finished noon conference. We learned about hemorrhagic shock and the massive transfusion protocol and how that works and all the lines and everything with hemorrhagic shock. So that was nice. That was a good conference. A nice 45 minutes away from the unit to like learn some additional stuff and also not be too stuck in the work that I had to do in the unit. But anyways, we have noon conferences every day other than the weekends, and it's typically either at 12 noon or 12:30, and we always learn something new, like a new topic, and it just helps us stay on top of our game, especially given that this is an academic setting. But right before noon conference, one of my patients actually passed away. The nurse came to grab me and tell me that, hey, my patient that was transitioned to comfort care yesterday, they noticed a change in their color, and they also noticed that the telemetry, the heart monitor, their heart rate was in the high 20s, low 30s. So when I went in, family was at bedside. They were very emotional. I had to do the whole physical/death exam. So I listened to the heart and the lungs, listened for a while, didn't hear any heart sounds, didn't hear any lung sounds. I checked for pulses, didn't feel any pulses. I then had to do a neurologic exam. So I checked their pupils, and pupils were blown. They were dilated and not reactive to light. I shone my light on it, and there was no reaction to the light. I checked for what we call a pain stimuli. So I tried to induce pain to see if she would react. And by that, I mean just squeezing on the fingertip. And there was no reaction to that. No rise on drop of the chest to indicate that she's breathing. And unfortunately, it meant that she was gone. So that was emotionally tough. I gave family some time to obviously be with their loved one, and and then I spoke to my senior about it. I spoke to my attendant, notified our attendant, and we all debriefed and made sure everyone was feeling okay. It's mentally exhausting, it's mentally tough, especially when you're the one like having to declare such bad news to family and loved ones. But yeah, took my time to debrief and get my emotions out, and then worked on the paperwork right before coming to lunch. So that was a nice escape from everything that's going on the unit. Medicine can be beautiful a lot of times when you get to save lives, but when you also lose a life, it can be emotionally tough. But I've got great support, thankfully. I've got a senior and an attendant that takes their time to like actually check in and make sure that we're doing okay and we're feeling okay. But yeah, I'm currently gonna go get myself some coffee and take a break. I forgot my lunch and my dinner that I packed, and Amanda brought it for me. She's I'm gonna go pick it up now. Thanks,
There's
B.
extra stuff in there to keep you awake.
Wow. Alright, so things are a little bit more quiet now. I got a new admission that I have to work on, but it is currently 8:55 p.m. and I'm gonna go have some dinner. And my senior is helping me cover the list while I eat and relax a little bit. The patient that passed away that I had to proclaim dead. I had to do all the paperwork that comes with that, and then we got a new admission who's a really sick patient, young patient, young guy, and he came in after a VFib arrest and was found to have what we call anoxic brain injury. With some edema and some herniation in his brain. So he initially went to the neuro ICU, but he got extubated 2 days ago and has been doing well. So he came back to the cardiac ICU because he kept going into ventricular tachycardia. But he's still quite sick. So I had to do a lot to settle him in, and then had another patient that we had to transfer to the main hospital because he's getting a heart transplant. So yeah, it's been a crazy busy day, and we're probably gonna get a new admission later tonight, but at least I have some downtime now to just eat my food, distress, relax, and I'll probably do some light reading as well. done. Time to go find a bathroom to see if I can brush my teeth. Okay, so I actually have another patient that's got an impeller, and that's an assistive device for your left ventricle. So I'm just learning further about it. I'm gonna read up this cheat sheet that my senior gave me, just to learn a little bit more about impellers. You're kidding me. No. I just try to get a little bit of rest. Just try to close my eyes for like 15-20 minutes before I have to go back. And the fire alarm goes off. Oh. All right, so it's currently 6:25 in the morning, and I just came back to the break room to wash my face, clean my face up, and just freshen up before I then go back to the unit again. I'll do one last round, make sure everyone is doing okay, all the patients are doing okay and tucked in well, and then I'll help write some notes for the team that's coming in. They should be getting in around 7. Make sure everyone is doing okay, help them out with their notes, and then I'll see them at 7, and I'll have to stay for morning rounds, present the new patients, and hopefully be out before noon. And that is it. It's a wrap. I just finished presenting my new patients from overnight to the team on rounds, and I signed out, and I'm all done. That was a busy and rough night, but I'm glad it's done. 28 hours in the heart and vascular ICU. I can't wait to go home and sleep. And I also have the next day off. Anyways, after I was done presenting and I was packing up my stuff to go, I got the biggest compliment that anyone could get. My attending, today's her last day on service. And when I was leaving, she was like, Charles, I just want to tell you, it's been a great honor working with you. You've been incredible. You're a star. You definitely have the cardiology vibes, and you're going to make a great cardiologist. That's literally all the motivation I need. Made my absolute day. I'm too buzzed now, and I don't even know if I can go home and sleep anymore. That was everything I needed. But anyways, thank you all for watching, and if you've made it this far, thank you. Catch you all on the next one.